An increase in COVID cases here in Indiana is straining hospitals and sending schools back into remote learning. Good afternoon, everyone, and welcome to 13 News at noon. We will get an update later this afternoon on the number of new cases, but as of yesterday afternoon, check this out. The state's latest report included another 15,000 COVID cases. That's the second highest day throughout this entire pandemic. That means we have already seen nearly 126,000 cases in just the first 2 weeks of January. It's also more than any other month last year. And with the exception of December, though that is expected to change, at this rate we're on track to top December cases within the next few days. Now, the rise in cases is impacting schools. 4 local districts are keeping kids at home because of COVID. Now, we know 8 IPS middle and high schools will be remote learning. The same goes for all Anderson community schools, and Heritage Christian will be closed tomorrow. We have all of these schools listed for you online at WTHR.com. And we are seeing these changes because so many staff members are catching COVID. And with the virus spreading fast, the state is just trying to keep up. Our Lauren Kostick is looking into the effort to track school outbreaks.
Since the summer of 2020, a team of contact tracers in Marion County has worked to identify COVID clusters.
It's hard to keep up. I don't think any contact tracing team in the country is keeping up right now.
Shandy Darth says cases can vary from 200 to 600 a week. Plus, her team is a lot smaller now.
The height of this, we had 200 people. We're down to about 55 right now, but obviously our case count is very high. So we really had to prioritize what cases we go after first.
That means focusing on the cases that impact schools, which includes anyone 20 or younger.
A key piece of information we're collecting right now is what school the child attends.
That way, the county can identify any outbreaks.
That's when Dr. Keene and her team can go in and have those conversations about if they need to go remote, maybe some grades or some classrooms. We're really trying to keep the schools open as much as possible.
Here's how it works. When someone tests positive, the results go to the Indiana Department of Health and are put in a statewide database that local health departments can access. Every day, contact tracers look at that data and assign cases.
We immediately, by 9 a.m., we start calling cases. We've learned, don't call too early and don't call too late in the day, but we call those cases to do the case investigation and also to collect any close contact information.
But since not every case is investigated, contact tracers encourage Hoosiers to reach out themselves, especially during this latest surge.
We realize we're not going to contact trace our way out of this. We really need vaccinations and lots of other things, mask use in place.
For now, the team is trying to get through this school year before making any new changes.
And the Biden administration plans to provide an additional 10 million COVID tests for schools every month. The administration also says it plans to send states billions of dollars to set up testing programs at schools. This morning, the president updated the country on that and a plan to order 500 million more COVID tests to meet demand. He also urged Americans to get vaccinated.
The single most important thing to determine your outcome in this pandemic is getting vaccinated. If you're not vaccinated, join the nearly 210 million American people who are vaccinated. If you are vaccinated, join the nearly 80 million Americans who have gotten the booster shot with the strongest protection possible. Vaccines are safe, they're free, and they're widely available. So do it today, please, for your sake, the sake of your kids, the sake of the country.
The administration says next week they will announce how to make high-quality masks available to all Americans.